Welcome to our Nursing Annual Report for 2018. I am proud to say that we have been a Magnet designated hospital for 12 years. Grounded in the core principles of Magnet, our nurses are in a unique position to support our Patients First mission and demonstrate the Northwestern medicine values of patients first, integrity, teamwork, and excellence. It's the culture of excellence that can be seen in our nurses every single day, not only in the work they do, but in the passion that drives every interaction. The three pillars of our nursing strategic roadmap of care delivery, care innovation, and care profession guide our nurses and our nurse leaders to advance the science and knowledge, set the standard for nursing professional practice, and deliver exceptional care. In this video, you will see just a few examples of the countless ways our clinical nurses are living out the principles of the Northwestern Medicine interprofessional relationship-based care practice model and taking advantage of our professional development opportunities, such as the Nursing Professional Development Pathway. In these ways, we are making far-reaching impact through the care we provide at Northwestern Memorial Hospital.
One goal of the Nursing Professional Practice Committee was to work with the EPIC team to implement Project One, which is our single electronic medical record that is used system-wide.
I've been a nurse here at Northwestern for the past 20 years, and I have gained a lot of experiences which have really helped me when it came to assisting with the build and the rollout of the new EMR.
We were the voice of nursing that helped determine what nursing procedures and skills needed to be implemented into Project One. While we were implementing changes for EPIC, we realized that medication administration for high-risk medications was not standardized, and our committee had to look at that process to make sure that patient safety was not being affected and make sure that our independent double checks were standard across the system. Independent double checks are when two nurses have to verify medication and the 7 rights of administration prior to signing off on the medication and administering it. So the Nursing Professional Practice Committee worked with the EPIC team to develop tip sheets to help nurses identify what needed to change in their workflow and their documentation and how to best incorporate that into their everyday workflow.
There was a lot of interdisciplinary collaboration, which really helped bring a lot of great ideas together to make sure that our medical record would suit the needs of all of our caregivers to best meet the needs of our patients.
I love my role as a patient care coordinator in radiology. I work with a team of 5 nurses that work on this incidental findings program and the critical lab value to make sure that patients and providers get their test results. I had a patient that came through the emergency department for an acute illness, and there was a lung nodule noted on the imaging by the radiologist. The patient was treated for the acute illness and then discharged. So I did a follow-up call to make sure that patient had the follow-up care for that pulmonary nodule. The patient had not established primary care with a provider, so I was able to help him connect with a provider here at Northwestern to address that finding. I love what I do because I'm able to be that safety net for patients to make sure that they're getting the follow-up that they need when they come to Northwestern.
Working with patients on ECMO in CT/ICU as a bedside nurse, I observed the detrimental impact that bloodstream infection had on patient care and patient outcomes.
ECMO takes the blood from the body through cannula. It's oxygenated and then returned to the patient. So we're supporting either their heart and lungs or just their lungs, depending on what type of therapy they need.
We realized that there are variations in nursing practice related to infection prevention and cannula care.
So we felt that we needed to come up with a standardized practice to care for these patients to try to prevent these bloodstream infections from occurring in them.
With the support of NMH Nurse Scholar Program, we were able to turn that idea into a evidence-based, nurse-driven, innovative research project. Every nursing leader and physician involved in caring for these patients supported us the whole way. We did a survey of other ECMO centers to find out what were their best practices. And based on that data, we created an interdisciplinary expert panel that decided on what our protocol should look like for this standardization process. It's really rewarding to be part of an interdisciplinary team that supports you every step of the way.
They're an amazing group of professionals. I can't imagine working anywhere else.
It's really rewarding to know that what you do at work is making a difference in someone else's life.
The Nursing Healthcare Policy and Procedure Subcommittee is underneath the Nursing Professional Practice Committee, and we review all policies that affect nursing bedside practice. And being involved as chair has just really opened my eyes to everything that you can do, and I'm able to do all of these amazing things and get all the support from my coworkers and the management. When we went to Springfield for Nurse Lobby Day, we were able to meet with congresspeople that were representing the Northwestern campuses. It's super important for us bedside nurses to go and talk to the representatives and tell them our stories and share our experiences. We have such a huge power as nurses to make real change to the laws that are affecting our practice. We were able to sit down with Kwame Raoul, who's the Attorney General-elect for Illinois. He was on the edge of his seat like we were on the edge of our seat, just really engaged, and it was a really powerful experience to have with him. So I've learned that you're able to make changes as a bedside nurse. I mean, if I can get one more nurse or one more bedside provider more involved in the legislative process, even if one more person goes out and votes, one more person calls or emails the representative, and I think I've made a difference.
A great way Northwestern has embraced inclusivity is through professional organizations. And one of those professional organizations that I got involved with is the American Assembly for Men in Nursing. Leadership was able to encourage us to start our own chapter at Northwestern for the greater Chicagoland area. The men and senior leadership come to our meetings and discuss their career paths and how they've gotten to where they are today. I'm passionate about this organization because it's a way to get involved and network with other nurses. Our most recent volunteer opportunity was with an organization called After School Matters. We had a few members of our organization go to a farm and help high school kids pick veggies, and at the end of the day we were able to talk to them about nursing and encourage them to embrace a career in nursing. I've been lucky enough to be the vice president of Chicago Men in Nursing, and it's given me the confidence to go back to school and attain my master's in nursing leadership. I think it's important to have men in nursing because the more difference in opinions and backgrounds, the stronger level of care I think you can provide.
One of the first things I noticed when I started nursing is that no one had prepared me for the emotional toll that caring for patients was going to take. And in the beginning I thought, oh no, I can't do this job and still be a friend, a daughter, a sister, all these kind of things outside of work if I'm pouring so much of myself into this job. And so when the Pathway Project came about, my idea was to create an opportunity to just come together and share. Fireside 15s happen on our unit about once a month, around the 15th, which is where the 15 comes from. They're open to everybody, and they're just kind of a meeting for staff to talk about any emotional challenges that we have. And so we put up a little fireplace on the screen to try to create a cozy environment. I think it's been a nice atmosphere to just have that attitude of, oh, I feel that way and I'm not alone in this. The IRBC practice model really promotes taking care of yourself so that you can take care of others. And so when we're supporting each other, we are at our best to care for our patients.
I received the Daisy Award after taking care of a young woman after she suffered a stroke. She lost her ability to speak and to communicate. And I designed a communication board to help her communicate without words. After Emily's stroke, she couldn't move her right side of her body. She had to learn how to walk and talk. That's a challenge for most people, but she also had to recreate herself as an artist. She wrote the most beautiful and moving nomination, and those words stick with me to this day.
I had no memory of leaving in the ambulance Mary Margaret, but I will never forget her. She must have been superhuman patient in order to figure out what I was trying to convey. I must have pointed to I have a question hundreds of times. I think we all as human beings need a Mary Margaret and the humanness and empathy she conveys.
Winning the Daisy Award made me recognize that each thing that you do for a patient or for a patient's family could make a huge difference in someone's recovery. At the year anniversary of her stroke, she walked onto the unit without using a cane, without using anything.
She did so much for me. She has a healing touch.
I love being a nurse. I can't imagine doing anything else.